Hello everyone, I'm Ravi from the Royal Pharmaceutical Society, and here today is my video on the daily updates around and the latest developments around the COVID-19 pandemic, but also what we're doing here at the RPS on behalf of the profession. Some of the key updates I thought I would let you all know about is probably three for me. There has been new guidance published from the government on shielding and protecting people defined on medical grounds as extremely vulnerable. And this guidance is published on the government website, and it's mainly for people, including children, who are at high risk of severe illness from COVID-19 or coronavirus because of their underlying health conditions, but also for those people's families, carers and relatives as well. That information is on the government website, but it's also on the RPS website and it's dated. So if you need an easier way, because there's lots of information coming out at the moment, do check out the RPS hub page. It's dated and it makes it easier to find all the latest developments. Secondly is new information, particularly from an England perspective, on the latest community pharmacy standard operating procedures. They've just been updated yesterday. They're now published and available for all to access. Some of the key information that's really important, I think, is that pharmacies have greater flexibility in closing their doors for up to 2.5 hours a day at the discretion of the responsible pharmacist. So I think that's either opening later, closing during the day for a few hours, and even for potentially closing slightly earlier to help manage the workload, the demand that's currently happening through the community pharmacy, but most importantly, to give you and your teams the well-deserved breaks that you guys desperately need. And lastly, some information on there about the new NHS delivery service and what that could look like. And also there is also confirmation in there of that pharmacists and their support teams are also part of the key NHS workers list. And actually the RPS letter that went out to all health teachers is also there as well for you guys to use and utilise. Thirdly is that NHS has also called for all pharmacists that have been retired or stopped working on the front line to return back to frontline practice. That also goes for pharmacy technicians as well. There's loads of information on the NHS website at the current moment in time where you could express your interest for this by filling out a survey, but also has a large number of FAQs that deal with issues around employment, whether you'll get paid for these type of activities, indemnity insurance, and information such as HR stuff like that, such as DBS checks as well. Some of the key things that we've been working on today, well, we've been hearing lots of stories once again from members, from the profession, from pharmacy teams across the NHS, and we know how hard you all are working. So today we've all, across RPS England, Scotland and Wales, sent letters to our respective ministers asking and seeking clarification on where we are with support and recognition for pharmacy teams, but also a latest update on where we are with some of the RPS policy asks we're lobbying government for at the moment. Secondly, we've had new updates to the RPS COVID-19 hub page. This includes information on hydroxychloroquine or chloroquine and its relationship with COVID-19, but also some new posters that we published on Friday around ensuring the public stay polite to pharmacy during these quite challenging times as well. And it's really important for people in the public to remember that pharmacists are working extremely hard with their teams to help deliver medicines, to give you the best healthcare advice where possible, and it's really important to remain polite, respectful and kind during these times as well. And there's also a new update on some tips for social distancing that I think could be quite helpful for pharmacy teams, but also for members of the public as well. So that's my update for today. I'll catch up with you all tomorrow. Once again, thank you for all the incredible work you're doing on the front line. You are fantastic. You are our NHS heroes, and I look forward to speaking to you tomorrow. Thanks.